Let's talk about 7 basic quality tools for healthcare improvement. This set of visual techniques is immensely helpful in assessing and managing quality issues. These 7 tools are relatively straightforward to use and can be used by people with little or no formal training in statistics. Together, they allow the healthcare improver to address and solve a wide variety of quality concerns. The 7 tools we will talk about are the check sheet, scatter diagram, histogram, Pareto chart, cause and effect diagram, flow chart, and control chart. The check sheet is a structured form for collecting and analyzing data. It can be adapted for a wide variety of purposes. Here is a scenario where a busy lab is interested in reducing how frequently tests that are requested by clinics and hospitals are cancelled by the lab, after a specimen has already been collected and sent to them. They are concerned about this problem because test cancellations adversely affect patient care and are expensive for labs. The lab manager keeps a check sheet to record the reasons for the next 50 lab test cancellations. This is what her check sheet looks like. As you can see, this tally helps her understand the most common reasons for lab test cancellations. A scatter diagram graphs pairs of numerical data, one variable on each axis, to look for a relationship. This is a scatter diagram that shows the relationship between the number of days it takes for a patient to get in to see a specialist at this clinic and their satisfaction scores. This diagram clearly demonstrates that a longer wait time for appointments adversely affects patient satisfaction. A histogram is a bar graph that shows frequency distributions and is an easy way to evaluate distribution of data. It essentially tells you how often each value in a dataset occurs. Here is a histogram that shows how well 11 clinics that are part of a healthcare system are doing with controlling their patients' blood pressures. This helps identify which clinics are doing well and which clinics not so well. We can then learn from improvement efforts at higher performing clinics and potentially use these efforts to help all clinics do a better job with blood pressure control. A Pareto chart is based on the Pareto principle, also known as the 80-20 rule or the law of the vital few. The principle states that for many events, 20% of causes are responsible for 80% of effects. The premise is that identifying these vital few 20% separates them from the trivial many. Then you can prioritize your efforts and direct your resources to where they may result in the greatest impact. A Pareto chart is a histogram where the lengths of the bars show the frequency with which an event occurs. Typically, a Pareto chart is rank ordered with the longest bars to the left and the shortest bars to the right. This allows the viewer to understand which situations occur more frequently or are more significant. The thinking is that process improvement efforts will be more effective if the categories on the left, which represent the vital few, are addressed first. This is a Pareto chart that helps us understand which types of medication errors in our hospital are the most common. A cause and effect diagram is a tool for discovering all the possible causes for a particular effect or outcome. It is also called a fishbone diagram and identifies many possible causes for an effect or problem and sorts ideas into useful categories. Here is a fishbone diagram that looks at reasons for patients being readmitted to the hospital after being sent home. Unplanned readmissions are harmful to patients' health, are a major cause of patient dissatisfaction, represent a waste of resources, and are terribly costly. A cause and effect diagram such as this one helps identify which causes to address first to solve the problem. A flow chart is a tool that visually represents all steps of a process. It builds a step-by-step picture of the process for analysis, discussion, or communication. Flow charts are used to define, standardize, or find areas for improvement in a process. This flow chart shows a patient's journey from the time they arrive at a clinic to the time they leave the clinic. The total time for a typical visit in this clinic is 120 minutes, or 2 hours on average, including lots of time spent in waiting. Drawing the process map helped the clinic staff understand that much of this time did not add value to the patient or a family. It helped them understand what part of the visit time contributed to wasted time or delays. A control chart is a graph used to study how a process changes over time. It is used to understand if a process will produce a product or service with consistent measurable properties. This control chart shows rates of central line associated bloodstream infections or CLABSIs in a hospital. Especially important here are peaks or variations in CLABSI rates. But how do we determine which, if any, of these peaks represents too many CLABSIs? Or asking this another way, how can we tell if this process is out of control? Evaluation of a control chart with an upper control limit or UCL line helps us answer this question. The dotted red line is the upper control limit, representing 3 standard deviations above the mean. Points falling above the upper control limit indicate months when the process was out of control. With this information, we can drill down on what happened during those months that might have caused CLABSI rates to rise. As with many things in healthcare, you can only manage what you measure. The 7 tools we covered, the check sheet, scatter diagram, histogram, Pareto chart, cause and effect diagram, flow chart, and control chart, help you measure key aspects of your project. They help you organize, prioritize, and effectively communicate your quality improvement efforts.